Thank you, Premier. As stated, really, up to this point, people have probably been focused on the classic symptoms of coronavirus, sore throat, fever, shortness of breath and cough. They're still relevant symptoms, and people who have those symptoms should present for testing. What we're going to emphasise now is that people with even the mildest of symptoms should think about presenting for symptoms. So a scratchy throat, a runny nose. There are even some unusual symptoms that are not that common, like loss of smell, that can be an indication of coronavirus infection. So these are some of the symptoms that people should think about. And it is an inconvenience to step up and get tested. But just like the physical distancing restrictions, this is the kind of sacrifice we make that will help us all in this battle. There's a greater level of confidence that I can have the more tests that come in. And if we can get to 100,000 tests in the next 2 weeks, it'll mean that there'll be no surprises. I'll have a very good picture of the transmission that might be occurring in the state, where it's occurring, in which populations it's occurring in. And that means that the decisions around lifting of restrictions can be made with the best evidence available. And the greater the data, the greater the number of tests that are done, means that that can be done with more confidence, and that we won't be surprised by a resurgence in an area that we haven't looked at. If we can really see what's going on in the state, then we can make some really well-informed decisions around what restrictions are lifted, at what time and where. So it is really critical that anyone with symptoms that are compatible with coronavirus, from the mildest of symptoms to the classic symptoms, comes forward for testing. It's a test that involves a swab that goes to the back of the nose and throat, but it will pick up virus if you've got it. It's a very good test. No test is perfect, but if you're infected with it, there's an extremely high likelihood that it will be detected and that we can find any chain of transmission out there. It opens up the possibility of ending chains of transmission in Victoria. That's the other key point here, is that we're driving numbers down lower and lower week on week with the restrictions that are in place. But another key part is that every individual you identify, you follow their close contacts. Those close contacts are quarantined, and there's no further transmission from those close contacts. So every case that's found is an opportunity to end a chain of transmission and to potentially end all chains of transmission in Victoria. We're down to very low numbers, 1 new case today, but we can identify any others that might be out there, and we can end all of those potential chains of transmission that might be there. So please consider, if you've got any symptoms compatible with coronavirus, to step up to one of those testing sites, whether it's a fixed site, a mobile site that's coming to you, or whether it's through your general practitioner or one of the hospital-associated pop-up clinics. So please do it. As I say, the data that we get gives me the confidence in making decisions over the next couple of weeks. Thank you.
Premier, can I ask you, you mentioned before, you cited other countries that...
Follow up on that for sure.
Yes, Simon, I'd certainly encourage kids to be tested as well. So again, much more likely to have very mild symptoms, but please present with your child with very mild symptoms. We know that influenza numbers are much, much lower at this point compared to last year, and that's because of the physical distancing that's in place. But it does mean that if you've got some flu-like illness symptoms, that you've probably got a higher probability of having coronavirus than some of the other viruses that are less infectious. So it does become important to present as a child, as someone with very mild symptoms, in order to pick it up. There may be an opportunity for a specific research project looking at kids so that we can get some of those numbers, because this has been an area where there's been insufficient evidence to properly, fully inform practice. And so it is helpful to get a really good picture of how many kids might carry the virus, how many of those might be asymptomatic, and how many might have mild illness, and the risk of transmission between them, because there are differing opinions on that, and the more data that we can have for kids, that'll obviously help us in decision making as well.
The parents who are struggling with homeschool, can you give any indication that it's likely this term current advice will change, or they might be encouraged to send their kids to school?
I'm open to it changing in this term. So The statement I've always said is that I will follow the numbers and I'll follow the evidence. There is new evidence that emerges in publications each week, but there's also a tracking of community cases and overall numbers that help inform decisions. And so I don't want to telegraph my intentions because I don't know, as I've said, what next week will look like or the following week. But the more that numbers can be driven down, and as I say, the more testing that can be done to help inform those decisions, the better off I am in being confident about them.
What's the greatest concern about school kids? Is it when they get to school, or is it how they get to school on public transport?
There's no real easy answer about where the risk of transmission is for kids. Obviously, we know that introduction of the virus has happened with adults coming to school, so that is a concern. But we also don't know the extent to which kids might have asymptomatic illness and be transmitting it to each other. It is comforting that kids don't get, by and large, serious illness. But that's not the same question as how much they might contribute to community transmission or broader population transmission, and that's the real driver in trying to minimise that in a school setting.
Just a very quick one. Just on the testing, will it be compulsory for healthcare and aged care workers?
No, it'll be an opt-in process for them, but we'd obviously encourage it, and I think largely they're very motivated to find out what the risk is to them and whether they might be infected with very mild symptoms in an emergency department or ICU or elsewhere.
How will you make sure that testing sites aren't overwhelmed with people rushing out very early on to get tested?
I think we've got a sufficient number of testing sites, and we've certainly got the laboratory capacity to be able to respond to really significant numbers, even if it were to happen today, tomorrow. But we'll keep an eye on things, and we can ramp up with mobile centres or seeing where the hotspots are in terms of demand.
Premier, we've seen.
Sorry?
You're hoping for big numbers.
Absolutely hoping for big numbers.
Premier, we've seen and reports that I've heard of more people down in Chill on the weekend.
Yes.
Sorry, I did ask the Premier this earlier, but could you walk us through what the distinction is in Victoria? And the Premier spoke about other states that haven't had as many community transmissions and others many cases. That's not the case in New South Wales, though, which is obviously allowing kids to go back to school. What's your thinking on this? Why are we taking the hardline approach?
I don't know that it's a hardline approach. As the Premier said, it's a fragile state that we're all in. I would like us to be in a position where I have absolute confidence that the next steps that we take in lifting restrictions are ones that are not going to get us into trouble. I think that's an important approach when the things at stake that I'm balancing here are so great. So when you look at those outbreaks overseas, when you look at how things have tracked, getting to a point where it escapes you is not an option for me. The community transmission that is in Victoria appears to be relatively small, but it's still 10% of our overall cases. That's not insignificant. 135 plus cases. And without really extensive testing, we don't know if that might be 200, 300, 500, 1,000 cases that haven't been detected. And so I would like to have that greater confidence to be able to make those decisions so that I don't see community transmission getting away from us when physical distancing restrictions or other restrictions are lifted. So I think that's key to my decision making. They haven't been moved out, but I think there is a plan for them to be transferred under the care of Alfred Health. I think they've got expertise, obviously, in the management of infectious diseases and coronavirus in particular. So it's really a case of being able to manage all of the infection prevention and control and any of the clinical needs that they might have as well. Thank you.
Thank you all very much.